Hello, everyone. Thank you for joining us today. I'm Aline Sigler. I'm a specialist with Provider Outreach and Education, and assisting me today is Karen Curtis. I'd like to thank her for being behind the scenes, adding things to the chat for me and monitoring that chat. Very helpful. Today's session is about using direct data entry and specifically using DDE to check eligibility and benefits for your patients. If you want a copy of this handout, it's available in the training center of our website. This is where we post the event materials for webinars, and we do that about a week in advance. So if you want to download a copy, you can find it there. It's going to be in the live events page. This is also where you can find out about and register for any of our upcoming educational events. It's probably what you did to sign up for this class, but sometimes we have people who forward the links to us, and so it's important to know where those came from, and you can see a list. We have a couple other direct data entry courses coming up in the next month or so, and so if you're interested in that, we invite you to check that out and register. The recording of this and other live webinars will be on our website. It's in a different place, also in the training center. It's the Encore presentations page. So if you miss an event because it doesn't work with your schedule, or you listened in but you want to listen to it again, you can find it there. Depending on the number of events, they normally are going to be out there for 60 to 90 days, but because of the volume of education we do, they kind of rotate on and rotate off. This is also good because if you can't go to YouTube during work hours or on your work computer, we also have a player embedded there on our website. So you can watch the videos there as long as they're available. Now, I mentioned our YouTube channel. This is where you can go to find those recordings of our live education, as well as some other shorter standalone videos on specific topics. The chat feature, you've seen Karen add a couple things there already. This is where you're going to put any questions that you have that are related to today's topic. At the end of our prepared remarks, we'll take as many questions as time allows today. Whether you're listening live or you're listening to the Encore, we hope you'll take the opportunity to give us your feedback by taking a survey. We survey every event that we do because CMS wants to know our providers' opinions about our education. How are we doing as educators, and how do you feel that WPS is doing as your contractor? You know, that's your opportunity to give us insight into how we're doing, and also the types of education that you want and need. This disclaimer just says that we are providing this information in the most accurate way and the complete way that we know possible. Medicare is a federal program. It does change sometimes. So you always want to rely on the CMS regulations as opposed to a WPS educational event, if there's ever a difference in the information that's presented. And then the next couple slides contain acronyms that were used in the creation of the presentation or that I know I'm specifically going to mention. Anybody who is maybe newer to DDE or Medicare, some of these acronyms might not be as familiar to you as others. And so we want to define them for you. This way, with the list, you can look back at them and see exactly what they mean. And that way we don't have to spell everything out on every single slide that we do. Now, as the description specified, this webinar is for Part A providers who bill using the Fiscal Intermediary Standard System. FIS. We use that to verify beneficiary eligibility using direct data entry, or DDE. And DDE is a fundamental part of FIS. To access it, users have to request it through our office. If you want information on how to go about that, you'll find a link to an article titled Direct Data Entry Overview. And that's on the resource slide, which is one of the last slides in the presentation. If you've downloaded a copy, you'll have all of those hyperlinks there for you so you can check those out. This article, that DDE Overview, explains the process and provides you with the forms that you're going to need in order to get started. Our goal is that by the end of this webinar, you'll have a better understanding of what information can be accessed in DDE as it pertains to checking a beneficiary's benefits and eligibility. We'll define some common terms, common working file. We call that CWF because, of course, it has to have an acronym. We'll learn how to enter the Health Insurance Query Access, or HIQA. We'll examine the types of eligibility information that are available, and then we'll discuss ways to troubleshoot if the beneficiary data isn't found. So we're going to begin with an overview of direct data entry. The Fiscal Intermediary Standard System, and I have to slow down when I say that because I get a little tongue-tied with terms sometimes. That's the processing system that was chosen or designated by CMS to be used for all Part A and Part B facility or institutional claims. Before claims processing contractors were known as MACs, Medicare Administrative Contractors, there were fiscal intermediaries for Part A, and so that's where that part of the name comes from. And then on the flip side, there were state Part B carriers, and they processed Part B claims for professional fees. So FIS is a standard system, meaning all contractors who process Part A claims have to use it. You might also hear or see FIS defined as the Fiscal Intermediary Shared System. You may see it listed that way on the CMS site. So I just wanted to make sure that you knew that those are both correct terms, whether you see it as shared or as standard. It's shared because all contractors share the use of it, but it's also the standard system because, like I said, that's the one that CMS has designated for use. Direct data entry is a real-time FIS application that gives you direct access for claims entry, correction of certain claims processing issues, and for inquiry purposes such as checking eligibility. It's also a valuable tool for providers who use batch submissions to transmit claims electronically. So you're downloading them in batches, we're receiving them in batches, but then you have the choice of getting direct data entry where you can actually work on your individual claims. You can look at your claims, watch your claims to completion, that sort of thing. Having DDE is not required. It's a business decision that you or someone in your organization makes. You're going to be working with vendors to connect to DDE, so there is a cost involved. We're just doing our best here today to give you the information about what it is and what you can do with it. With DDE, you're able to monitor the claims that you've submitted, whether you do that individually, you're keying them into the system, or that you've transmitted in batches. This is what we call your window into your claims. So once they get into FIS, you can manage your errors, you can access certain informational files that will help you in claims processing. And then that last bullet, and the reason that we're here today, is that you can check the beneficiary's eligibility information and their master record on what's called common working file. So that's the next thing that we're going to take a look at and define. And we're going to do that before we go into the details of what information is actually available. So the Common Working File, or CWF, is a system that provides a single source where all contractors can verify beneficiary entitlement and eligibility data, as well as claims history. So Common Working File is basically a warehouse that holds all the data that's processed by each of the MACs and other entities such as Social Security and the Benefits Coordination and Recovery Center. Information on Common Working Files updated daily, so that helps ensure that copays and deductibles are applied correctly, and it prevents duplicate billing. Common Working File is comprised of 9 localized databases, which we call hosts. These host sites are broken down into geographical locations, and we'll talk about that in just a minute. Beneficiary records are assigned to a host site based on where they sign up for Social Security benefits. And this will make more sense when you're actually trying to find their eligibility information. So here are those 9 different host sites, along with the states which are included in that site, states and other areas, or territories. So I mentioned that a beneficiary is assigned to a site based on where they sign up for their Social Security benefits. So let's say a beneficiary is born and signs up in Iowa. So they would assign the beneficiary, they meaning Common Working File, would assign the beneficiary to the Great Western host site. I just use Iowa as an example because that's where I am physically located. So let's say then that this same beneficiary is, maybe they leave Iowa in the winter. So we call them maybe a snowbird. And then they go to stay in Arizona or Florida or Texas or, some of those very common areas. If this beneficiary needed to receive medical services while they were in those other states, the host site for Arizona, let's say, is Pacific. Texas is in the southwest. Over here is Texas. And then, what's the other one I said? Florida. Florida is in the southern host site. So you can see that those are all different. So usually, Common Working File will automatically search all of the different host sites to find the one in which the beneficiary is located. But there have been instances, back when I worked in claims and Karen worked in claims and customer service, where we would actually have to manually check every host site before we could locate the beneficiary's master record. And I tell you all of this because you might get a message that the beneficiary can't be found. So there are steps that you can take to try to locate their records to check their eligibility. Another situation that comes to mind is those people who have moved around a lot. Maybe they were a disabled dependent of military personnel, or even just because of their employment, they've moved around a lot. So just because where they are when they come to you for services might not be where their records are housed. I hope this makes sense. So you can see here, the states that are in jurisdiction 5 can be found in the Great Western host site. So we have Iowa, Kansas, Nebraska, Missouri. The states in jurisdiction 8 are in the Great Lakes. There's Great Lakes. Michigan is down here. And Indiana is assigned to Mid-Atlantic. So these are just things to keep in mind. Another thing I want to draw your attention to is the Southern host site. RRB, Railroad Retirement Board. If you have a Medicare beneficiary that's a railroad retiree, their master records are more than likely going to be located here, regardless of where they live. Back in the day, A patient's Medicare number was usually their Social Security number or their spouse's, followed by a letter or a letter and a number. Railroad beneficiaries had the letter preceding the Social Security number. So it was very easy to tell which they were just by looking at their old HIC, health insurance claim number. Since the transition away from Social Security-based Medicare beneficiary identifiers, they're now random alphanumeric identifiers, you actually have to look at the patient's Medicare card. Railroad beneficiaries have the railroad seal in the top left corner, as opposed to the Health and Human Services logo. And then there's also a red banner across the bottom that states Railroad Retirement Board. So just a couple hints for you there to hopefully put these pieces together as you go forward and you use these things and things that make sense, and hopefully to try to explain why things are the way they are. We're going to go through the common working file screens in more detail, but first, here's a list of some of the information you can find. Benefit periods will be displayed with remaining days. It'll tell you whether or not the beneficiary has a Medicare Advantage plan or that they've elected their hospice period. These will help you determine where you should be sending your claims. Information about preventive services that the beneficiary has received can also be found, and that'll help you determine if the patient is eligible for certain services and help you avoid some of those frequency rejections. A lot of preventive services are covered only for certain people, certain age, with certain conditions maybe, or only so often. So not only will it help you avoid rejections, if you need to issue an ABN, let's say, it can also help you with that. So let's move on and look at what eligibility information you'll be able to view by using direct data entry. I'll start off by saying that accessing direct data entry and how the screens appear can differ depending on the connectivity software that you're using. If you already have it and your screens don't look exactly like what I'm showing today, there should be some similar fields. So you're going to start off by logging into DDE using your user ID and your password. Then you'll type HIQA or ELGA and press enter. Now your vendor may customize your view. So some of the information may be programmed or auto-populate for you. So some of these fields, as we go through, if you currently use it, you might say, well, I don't have to do that. Your vendor may do it for you behind the scenes, and so you didn't even realize that. So we're just doing bare bones here if there were no customization at all. That's what we'll be looking at today. So if you type in HIQA, your screen should look similar to what you see here. You'll need to enter the patient's MBI, so that's going to go in the claim number field. The surname should include the patient's last name and suffix, if there is one. Initial would be the first initial of the patient's first name. The sex code field will accept M for male, F for female, or U for unknown. The next three fields are provider related. So the requester ID would be the ID that you use to sign on. Inter number refers to the intermediary number. So for example, if you are a provider based in Iowa, your intermediary number would be 05101. If you're based in Michigan, your intermediary number would be 08201. So these are a couple examples of things that might auto-populate for you based on the vendor that you're using. Your NPI would be entered in the NPI number field, and then the next two fields are optional. I mentioned earlier that Common Working File usually automatically checks all of the host IDs to find the beneficiary information. But if you would like to add one, you can add the ID. You can see they've all been listed here over to the side: Great Lakes, Great Western, Keystone, Mid-Atlantic, etc. So they each have a 2-digit code. So if you want to specifically check a certain host site, you can add that there. If a date's entered in the app date field, information such as MSP records, inpatient stays, home health episodes, hospice periods, Part B deductible, therapy thresholds, Medicare Advantage plans, those are going to display based on the dates that you've entered. So if you only wanted to check the records for a certain period, you could do that. And then the reason code field will default to a 1. You should never have to enter that. That's just a default. Now, if we switch and we go to ELGA, again, this is going to be based on what your vendor has recommended that you use. The ELGA screen is going to look almost identical to the HIQA screen, with the exception that the claim number has been replaced with HIC/MBI number, health insurance claim or Medicare beneficiary identifier number. That's the patient's Medicare number. And then there's an additional field titled response code, which is also populated by the system with a P, which stands for production. So here we have the first page of the inquiry. If this is new to you, I know that this is a lot of fields, a lot of letters and numbers, strange acronyms, strange abbreviations here. And so it takes a little bit as you use it for your eyes to get trained to look for specific things. Now, it's not going to be different colors when you sign on and you look at it. So I've done a couple things here on this pretend patient just to kind of give you examples. We don't have time to go over every single field on this screen, but there are some things that I would like to point out. Page 1 has the entitlement and termination dates for both Part A and Part B. So we have A, entitlement, A, termination, if their benefits were terminated for some reason. Same with B, B, entitlement, B, termination. There's also a DOD, date of death field. So if your beneficiary happened to be deceased, you might still have some claims you need to finalize or finish up for them. So that would be listed there. Next to that, you'll see fields that show any remaining lifetime reserve. LRSV stands for lifetime reserve. LPSY stands for lifetime psychiatric days. As we move down this screen, you'll find benefit period information. So days left in the current benefit period. If they had a prior benefit period, this line might also be populated. You'll see how many hospitals, skilled nursing facility days, and these are ones that remain. It says days left. You'll also see the date of earliest billing action, date of latest billing action. That's what DWEBA and DOLBA stand for. I know those were very strange abbreviations when I first started looking at this information. And why would that be important? So if the patient was admitting to your facility for an inpatient stay, you would need to know if they'd been an inpatient anywhere in the last 60 days. This is going to help you know if you're working with an existing benefit period or the patient would be starting a new one when they admitted to your facility. This information can only be updated as claims are processed. So if you go out here and let's just say you're a hospital and you see 0 full, 0 coinsurance, 0 lifetime reserve, but your date of latest billing action was more than 60 days ago. So when they admitted to your facility, they would probably, no guarantee, probably be starting a new benefit period and would have full benefits. There's also a line to show information for the prior benefit period. Like I said, this fake patient doesn't have one, but it might be listed there. Next is a line for some Part B information. So that's going to include the deductible. TBM stands for to be met. Also information about the blood deductible over here. If the patient's enrolled in a Medicare Advantage plan, you're going to find the plan number. So the plan number is this H code. It'll give you the enrollment and the termination dates. The option field tells you if the HMO or managed care processes all of the patient's bills or if they only process bills from providers whom they have arrangements with. Now, this example shows option C, which means it's a replacement plan. So all claims will be sent to the managed care plan. It's open enrollment time, so you're probably going to see a lot more patients who are going from managed Medicare or Medicare Advantage back to traditional or vice versa, or even in managed care but changing plans. So it's important to know where you can find that information. Next information for Part A includes the current year and the blood deductible. We have the therapy thresholds. So we have information about physical therapy to be met, occupational therapy to be met. So for outpatient rehabilitation, we have 2 different therapy thresholds. One's for occupational therapy, and the PT also includes speech language pathology. If a patient is entitled to Medicare due to end-stage renal disease, then the bottom portion of that screen is going to show if they're enrolled in Method 1 or Method 2. So you can see that way down here, ESRD, end-stage renal disease. Method 1 means the patient will receive all supplies and equipment for home dialysis from an ESRD facility. Method 2 indicates that the patient will deal directly with one supplier for home dialysis supplies and equipment. So that's page 1. A lot of information here. Not every field is utilized by Medicare. So if you see a field and it doesn't make sense to you, it just might be that that's something either the system or Social Security or some other contractor uses, not necessarily for all patients for all instances. So let's move on to pages 2 and 3. This information relates to transplants and hospice. The top shows transplant data. If the patient had a transplant, the COV indicator is going to indicate whether or not the transplant was covered. COV stands for covered. The trans indicator will show the type of transplant. For example, H means heart, K means kidney, that sort of thing. Numbers 1 and 2 refer to bone marrow transplants. The date the patient was discharged from the hospital stay that involved receiving the transplant will also be shown here. If the patient elected their hospice benefit, start and end dates will be shown here, down in this area for hospice. There's a field that's titled owner change. This field will be populated if there was a change in ownership of the hospice provider within an election period. Enter 1, right here, INTER 1, will show the contractor that's processing the hospice claims. I'm assuming inter at one time meant intermediary. If the beneficiary wants to change hospices, or if there's a hospice change of ownership during the benefit period and claims would be sent to a different contractor, that will be listed in Inter 2. That's a little further down the page. Patient who qualifies can get hospice care for 2 90-day periods, followed by an unlimited number of 60-day benefit periods. Way down at the bottom, this revocation indicator. This is important. This is something that you'll want to pay attention to because it's going to let you know whether or not hospice is still active. Anything other than 0 means the hospice period has been revoked. So not just that the dates that either 90 or 60-day period has lapsed and you're past that end date, but that the patient has formally revoked their hospice benefit in writing. That's going to make a difference in your claims processing. Moving on to page 4. Page 4 is going to provide information regarding the patient's home health benefits. The spell number indicates the current home health spell of illness. The qualifying indicator tells a qualifying or indicates a qualifying A-B split hospitalization. Part A visits remaining shows the number of Part A visits remaining in the benefit period. Medicare Part A will pay for the first 100 visits if the beneficiary has a qualifying stay. The remaining visits would be paid under Part B. If there is no qualifying hospital stay, all visits would be paid under Part B. This page will also show the date of earliest and latest billing. Page 5 also displays information related to home health. The data on this page is going to include the start and the end dates, along with the date of earliest and latest billing. Page 6 contains information related to preventive services. Services are listed, including the HCPCS code for that service. So as you can see, some of the services have more than one HCPCS code related to them, depending on exactly what the service is. You also notice some wording in some of the rows. So just a couple examples here. For the IPPE, the Welcome to Medicare visit, it shows the beneficiary is not eligible. So down here, here's an example. SRV, service, NO, not, and ELG, eligible. So you might see that if a beneficiary is not eligible for this service, because it has to be performed within the first 12 months after the patient becomes entitled to Medicare Part B. Another example over here on the right-hand side, PP vaccine, pneumococcal pneumonia. It shows the beneficiary has received their vaccination. Since this beneficiary is male, you see that up in the header that the beneficiary is a male. It shows gender not eligible for screening mammogram and the pap smear. So gender not eligible. So just some examples of some of the abbreviations that you might see when looking at this screen. Other messages may show ineligibility due to age. Some of our preventive services have age requirements. This is page 7, and it's additional preventive and screening services. This screen shows examples for lung cancer screening. So age, no eligible. Because this service requires the patient to be between age 50 and 77. Another example shown here is the HPV screening, which is currently covered for women between the ages of 30 and 65. So just a couple examples here. Moving on to page 8. This has information related to bone density studies. Procedure codes are listed, has a description of those codes if they were a technical or professional component. The risk field, as far as I know, this column right here, is currently not used that I'm aware of. The most recent date of service will be the 3 most recent dates of service for that code. Page 9 is where you're going to find information related to smoking cessation. The counseling period provides up to 5 years of data. Services will be listed by HCPCS along with the from and through dates. PER, kind of circle it here. That identifies the counseling year. QT, I'm assuming that means quantity. That's going to show you the number of services billed, while TP, type, shows you the claim type. So those different fields that we have here. Page 10, this is where you're going to find rehabilitation information related to pulmonary and cardiac rehab, along with intensive cardiac rehab. Services are broken down into technical and professional components. Notice that the information for pulmonary gives you the number of services remaining, while the data for cardiac rehab gives you the number of services applied. Now, I don't know why they're different, but I just wanted to point that out to you. You can't assume that each is the same or looks the same or the information is in the same way. Moving on to page 11. This is for home health certification, certifying that plan of care data. It's going to display up to 20 occurrences of the HCPCS codes G0179 and G0180 with the dates for certification up to 9 months prior to the current date. Page 12 is for telehealth services. This screen separates telehealth services rendered under hospital care and those that were rendered under nursing care. HCPCS that have been billed will be listed here. The next eligible date will show the date on which the beneficiary is eligible to receive the services again. And at the bottom is a rule. That's a rule that will show the allowed HCPCS, modifier information, and frequency, just as a reminder for whoever's looking at this page of information. Page 13 contains screening and counseling services for alcohol, depression, intensive behavioral therapy for cardiovascular disease and obesity. It's going to list the next eligible dates along with the number of remaining visits. Just examples of the kind of information that you might see for some of your patients. Page 14 gives us information for screening and counseling for sexually transmitted infections. The code used to bill for the screening will be shown along with the next eligible dates, and the services are broken down into technical and professional components. Page 15, bone density. It has its own page with next eligible dates for both the technical and professional component. There's also a rule that reminds you of this service and that it's allowed every 24 months. Lastly, we have the Medicare Care Choices Model data. CMS tested an option for beneficiaries to receive supported care services from selected hospice providers while continuing to receive services provided by other Medicare providers, including care for their terminal condition. So this screen lists the hospice provider along with the start and end dates. The transfer date identifies a change of ownership. So that was an overview of the type of information on each page of eligibility and beneficiary information on the Common Working File using HIQA. Now, of course, not every patient is going to have items on every page or in every field. We can't use actual patient data, and so my make-believe patient that we saw on page 1 didn't have all of these items populated. So now let's talk about what happens when you experience issues trying to find a beneficiary in Common Working File. At the beginning of our time together today, I mentioned that there might be times when you enter a beneficiary's information and you receive a message that might read TNIF, transfer not in file. This can occur for multiple reasons, and I listed some of them here. Although the system should search each host site, you may have luck if you manually type in each of the host IDs into the host ID field. That was that first field that we looked at where we entered all the patient demographic information. Remember when we talked about beneficiaries who are retired railroad workers? Remember that they will always be found in the southern host site, regardless of where they registered for Social Security benefits. So that's one of the error types that you might receive. Next is beneficiary not found. If you receive an error that states the beneficiary is just not found, you might have to do a little more research. First, verify the name and Medicare number match what's shown on the patient's Medicare card. If the beneficiary lost their card, it was stolen, it went through the washing machine, so it was otherwise compromised somehow, Social Security may issue them a new card with a completely different number. Now, it wasn't like that in the past. When they were Social Security based, if you needed a new card, you were always going to have the same number. Due to changes and privacy information and fraud, that's no longer the case. If a new card is issued, they may have a completely different number. Some beneficiaries don't use their legal name. So you might know the patient as Hank, and that's how he's registered in your system at your office or at your hospital. But his name is really Henry. Miss Peggy might actually be Margaret, or they go by their middle name. That happens a lot. We all know people with nicknames. It needs to match what's on their red, white, and blue Medicare card, or you're going to have difficulty finding the patient's eligibility and getting your claims to process. You should be asking for that every time. Another option is to use our MBI lookup tool. It's located within the secure section of our website. We call that the Secure Net Access Portal, or SNAP. To use this option, you need to be registered and have a user account with us for the portal. It's easy to use, so I do recommend that you do that. The information required includes the beneficiary's Social Security number, their first and last name, any prefix or suffix, if that's applicable, and their date of birth. If the information entered is correct, the patient's MBI will be provided. So I have a list for you of resources that you might find helpful. The Common Working File chapter of the Medicare Claims Processing Manual, which is 100-04. It provides information on the specific errors that can be received when attempting to find beneficiaries. You're also going to find reasons for the errors and, in some cases, guidance or action that the system takes. There are some circumstances in which the claim will automatically recycle back to Common Working File every 15 days. I've also listed here, and I mentioned this, the Direct Data Entry Overview article. And then there's also a link to the actual Direct Data Entry Manual. That's going to walk you through these different pages of information, reminders about how to log on, log off, how to move forward and backward between pages or even within a page. All of that information is going to be in the DDE user manual. So now I'm going to pause here and I'm going to check in with Karen. I'm going to see what questions you have related to today's topic. Now, today's webinar was meant to be an entry-level course. Anything that you have that's claim specific, so if you're asking about a particular beneficiary or a particular claim, those are going to have to go to customer service because I don't have access to the system itself. I can't look at your claims with you, so they can help you and provide advice. Now, if we run out of time, you will have another option or opportunity to send questions in. We'll talk about that in just a minute. So Karen, have we gotten any questions in the chat?
Aline, thanks for all that great information. Right now, we do not have any questions that have come in.
Thanks for checking. And I understand sometimes when you're just learning about something, you're just seeing these screens, you're not really sure what questions you have yet, and that's fine. Like I said, you do have another opportunity coming up. I'm going to move on then. And I want to talk about your email that you're going to get after this class is over. You're going to receive an email and it's going to be sent to the same email that you registered and joined with. Now, if you joined by phone only, then we don't have your email address and our system can't automatically send that to you. So what you can do is just send us an email. We'll verify the phone number that you dialed in with matches the report that we get from WebEx, and you can get your certificate that way, because that's one of the things that this email contains. And you can see it over here on the right is just an example of what that email looks like. It's going to have your certificate of achievement, and we put a red box around it. It's not going to have a red box when you get your email. But just to draw your attention to the fact that it lists the course, the date you completed it, and your contact hours. So if you are needing continuing education units from your accrediting body, you should be able to screen print that email, because of course your name is going to be in the to field, and you can submit that for consideration for contact hours or CEUs. The other thing at the top, that top red box, is another way to give us your feedback through the survey. You'll see this email in probably the next 10 or 15 minutes. And we just wanted to make sure that you were aware of it, that it was coming, and that if you don't see it, check your junk or spam folder for one, and then make sure the WebEx email address is added to your safe sender list also. For those of you who are listening to this class as an encore, so you're listening to the recording, we also thank you for listening in. Unfortunately, we don't have a way to track your attendance, so a certificate isn't available for that. I mentioned that if you think of a question later, you do have 1 week from today to submit those follow-up questions. You can send them to our same education mailbox. Just put today's date, something about DDE or eligibility in DDE in your subject line, and that way they'll be sent directly to me, and I will provide an answer for you. I've mentioned this a couple times now. Please take a few minutes to complete a survey about this course. It's the only way that we know if what we're doing makes an impact, if you liked it, what we could do better. Give us suggestions for future education. You do have a few options. I talked about the link that's going to be coming in your thank you for attending email. You can also use the link that I'm going to have Karen put in the chat. Or when you exit the webinar, you're going to be asked to go to an external site. You're going to see a message that looks kind of like this screenshot down here with the triangle and the blue continue button. And that, if this is the first webinar that you've attended, that might look a little fishy to you, but it is safe. It's just going to take you to the Qualtrics site for the survey. And you'll do that just by clicking that blue continue button, and it'll start that survey for you right away. If you're listening to this course as an encore, you're going to get a box at the end of the video that's going to link you to the survey. Or if you scroll down to the description of the video, you'll see the link there. Those surveys are so important to us. We look at them daily, so does CMS. And so that's how we know how we're doing. That's how we know the types of education that you're interested in. And just to prove that we do look at those surveys and we do take your feedback to heart, we are committed to making changes to improve your education. We have a couple examples here. Based on survey comments, we have incorporated chapters into our YouTube videos. So that way you can jump to specific sections within a video. Like maybe you just want to hone in on the question and answer portion. Or maybe there was a portion within that video that you wanted to hear again. You can do that. We're also beginning to use training indicators. And those are going to help you determine if an event or material applies to you. You might have seen them in the description of some of our courses. We have examples here of training indicators, whether they're billing or clinical related, or dealing with documentation examples, or if the event is part of a series. We have a page on our website that defines them all for you if you are not used to looking at them yet. And then the last bullet here is our Medicare Education Expo. It's the result of providers telling us that they wanted to go more in depth on a subject, like we used to do when we used to be able to do in-person seminars, like our Medicare Day of Learning events. So we're holding these all-day sessions where we have multiple webinars in a day and focused on a particular topic or process, let's say. With that being said, on behalf of myself, Karen, all of us in Provider Outreach and Education, I want to thank you for taking the time to spend with us today to participate and learn more about direct data entry. We hope to have you join us for future education, and we look forward to your survey feedback. So you may now disconnect.